Hey everyone, I'm Judith, an ICU nurse, an FNP student, and a mom of two. This is part one of my ADPIE exam series, and we're starting with A, assessment. By the end of this video, you're going to know exactly what it means to see assessment on a test, the specific words that tell you a question is telling you to assess, and how to use that to stop missing questions you actually know the answers to. Subscribe so you get every part of the series. Let's get into it. Assessment is the first step of the nursing process. It means one thing: gathering data. Before a nurse does anything, give a medication, make a phone call, position a patient, call a rapid, the nurse collects information. On a test, this means before you choose an intervention, you need to ask yourself, do I have enough information to act? If the answer is no, the correct answer is almost always to assess first. Write this down and put it somewhere you'll see it every day. Data before action. That phrase will save you more points than any amount of studying will. Now here's what I really want you to take down from this video. Ask questions, leave clues. And once you know what you're looking for, you will see them everywhere. These are the trigger words that are telling you the answer is to assess. Group 1, priority and first action words. When you see first, initial, priority, most important, immediately, before, those words are asking you what happens before anything else. And if you don't have data yet, what happens first is assessment. For example, what is the priority nursing action? Slow down. Do you have enough action? Do you have enough data to act? If not, assess. Group 2, data collection words. When you see assess, monitor, observe, check, auscultate, palpate, inspect, obtain, determine, identify, note. The question is literally telling you, collect information. This sounds obvious, but students will still pick interventions, and I know this as a TA of fundamentals. Don't do it. If the word assess or monitor is in the question, you know you need to assess. Group 3, patient report words. When you see reports, complains of, states, tells the nurse, describes, the patient has given you subjective information. That means you now have to go and get objective information or objective data that goes with it. You cannot act on the patient report's chest pain alone. You need to assess. What are their vitals? What does the pain feel like? When did it start? What makes it worse? Use a pain scale. Subjective data triggers the need for objective data. Every time. Group 4, clinical change words. When you see sudden onset, change in condition, newly admitted, just returned from, worsening, new complaint. Anytime there is a change, you assess before you act. This is one of the biggest traps in nursing school questions. A patient who was stable an hour ago and is now reporting shortness of breath. What do you do first? You assess. Auscultate lung sound, check oxygen saturation, get a respiratory rate, then act. Group 5, information gap words. When you see which finding, which data, which information, what would the nurse expect to find? These are asking you to identify assessment data, not perform an intervention. They're testing whether you know what you should be looking for, and that's assessment. Now I'm going to give you a framework for applying this. I call it the question within a question method. I didn't make that up, but I did discover that that's what I was doing. Every time you read a test question, before you look at the answer choices, ask yourself 3 things. Number 1, what phase of ADPIE is this question? Look for your trigger words. Is the first action true? Is there a which finding question? Identify the phase before you answer the question. Number 2, do I have enough data before I act? Read the scenario. Has the nurse already assessed? Are there vital signs? Are there lab values? If the scenario gives you data, you can move on to the next step. If all you have is subjective data, you need to assess. Number 3, is assessment an answer option? If assess the patient or monitor or auscultate is one of the choices, that should put a little red flag. In the assessment phase, this answer always wins. Run every question through these steps and you'll be fine. One more thing before we wrap, and I've kind of mentioned it throughout this video. Assessment has 2 types, subjective and objective. Please, please, please know the difference. Study the difference. Be the difference. Subjective is what the patient tells you. Pain, nausea, anxiety, fatigue. You cannot measure it. You only know it because the patient tells you. Pain is tricky because the act of them having pain is subjective, but pain levels, if you're using a scale, can be used as objective data because it's what you would use to do the intervention of administering pain medication. So pain is tricky, and we're going to put that to the side. Assume, though, that in general, being told that they have pain is just subjective. The key phrases are the patient states, reports, describes, or complains of. That is subjective. Objective data is what you can see, measure, or observe. Things like vital signs, lab values, lung sound, skin color, or edema that's visible, oxygen saturation on the monitor. So these key phrases are the nurse observed, notes, assess, auscultate, or measures. When you see those within the question, you know that the assessment has been done. Let me leave you with 3 simple things that kind of summarizes what we talked about today. 1, data before action, always. 2, know your trigger words. First priority initial reports, change in condition, which finding. And 3, when in doubt, ask yourself, do I have enough information to act? If no, assess. Part 2 is coming next week. We're going to be discussing diagnosis, which is where students kind of second guess themselves. Subscribe so you don't miss. I'll see you in part 2.